Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm delighted to have as my guest Dr. Jeffrey Pierce. Dr. Pierce is a medical physician, board certified in both lifestyle medicine and family medicine, and a member of the Love.Life Telehealth consultation service. Welcome, Jeff. It's a pleasure to meet you. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thank you very much for having me. It's a pleasure to meet you as well, Dr. Sabatino.
Yeah, when I was going through your history, there were a number of really kind of intriguing things to me about your history, and I wanted to kind of touch a little bit on those. I noticed, we always like to know how people kind of got interested, especially initially in plant-based living. And I know it goes back to the year 2000 for you when you were kind of a vegetarian back there. But I noticed something that as you were teaching doctors through that health service where you were teaching high risk and surgical obstetrics, you made the statement that that kind of turned you on during that time to the power of plant-based, healthcare, basically. So talk a little bit about that evolution. What did you actually mean by that, and how did it evolve from your and I know vegetarian you were turned on initially because of the animal abuse issues in food production. So talk a little bit about your evolution into that statement where you say now you got turned on that kind of teaching situation you were doing.
Sure thing. So I was born and raised in Texas, and certainly didn't know many plant-based eaters back when I was a kid. And it was in my last year of college where I saw a film about sort of factory farms, and that was all pretty new to me. And so that created a shift in my food choices. And but I felt like it was sort of a personal choice, and I didn't want to proselytize about it. So I kept it to myself, and all throughout medical school and residency training, I didn't really learn anything about the power of a really healthy diet, of a plant-centered, plant-forward diet. And so I just sort of kept that, my own personal habits to myself. And it was only after starting to learn a little bit more about folks from some of these wonderful organizations that have influenced us. Let's see, I remember my upper level resident buddy, Dr. Heller, told me, you know what, you should check out a couple of these sites. Have you heard about Neil Barnard and the Physicians Committee for Responsible Medicine? Have you heard about Scott Stoll and the Plantrition Project? And it was all new to me, even though I was doing my training in Santa Rosa, where Dr. McDougall's program is based and where True North, Dr. Goldhammer's work is based. It was just not on my radar. I was very much focused on global health and obstetrics and other things. And I'll tell you that I did global health for a while, and I found just the power of seeing people get well very quickly. I loved, someone who had malaria or had advanced HIV. When you put them on the right medicines, they got better so much quicker. I didn't see that when I was in residency training doing chronic care for people with high blood pressure and diabetes. I just sort of felt like I was managing their conditions. But then when I was turned on to these groups that I just mentioned, Dr. Barnard's group, Dr. Stoll's group, et cetera, and Dr. Greger's work, to name just a few, I was blown away. And I thought, well, there's no way I can keep this to myself now. Now that I realize that it's not just a personal decision about animal compassion, but it's really something that will help folks get off their medications in many instances, and not just have their chronic illnesses managed. I was like, well, now I got to learn more about it and teach about it. And that's when I became boarded in lifestyle medicine, and where now I help to teach that and bring that also to my patients.
Yeah, Jeff, taking a step back, I found it interesting in that in your global health perspective that, you were taking care of families and people in different countries in Africa and those kinds of places, Kenya, Sudan. Talk a little bit about how that transpired. How did that experience become a part of your life? How did you get involved with that kind of care?
Sure. So I'm from particularly South Texas, and when I was in my pre-med school years, made some sort of short mission work trips down into Mexico, and then also went on a research summer abroad to Peru, and just found that the disparity in number of healthcare practitioners per patient population and the amount of just devastating acute illnesses in countries that are typically along the equator are just very, very different than what I was seeing even in inner city Houston, where I ended up going to medical school. And so I was lucky enough to be at a med school, that's Baylor College of Medicine, that had a global health program. I went through that. I got training in tropical medicine, HIV, and things like that. And after residency, my first job was working in a little African country named Lesotho.
Right.
And that was just some really meaningful work. And I enjoyed working in several of these countries for years, and then settled down and started a family, and have not been working abroad since our daughter, who's now getting ready to turn 10, actually.
Wow.
So we've been pretty much stateside in large part due to that.
How long did you spend time in Africa like that, along the equator?
Yeah, so let's see. I finished residency in 2007 and was working back and forth between the U.S. and Africa until about 2014. So about 7 years.
And the center where you were teaching, high-risk obstetric care and surgical care, are you still connected with that? Is that still part of what you do?
Definitely, and I get to work on labor and delivery with family medicine learners, and it's a great way to keep my own skills sharp, right? Because you're always working with when you're working with people in training, they keep you honest and make sure you know what you're talking about. And I can talk with the patients who come there a little bit about lifestyle medicine, but then additionally, just recently, starting to do more in the outpatient setting with those folks at the county, where we are having some more dedicated groups to food as medicine in diabetes and in pregnancy and things like that. So that's very exciting for me as well. Not just being there for the moment of delivery, but seeing how we can help shape not only that patient's life through her pregnancy, but also the future of their children to be.
That's beautiful. Yeah, I'm here with Dr. Jeffrey Pierce. We're going to take just a very short break to hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here, encouraging you to check out the NHA membership. For just $35 a year in the U.S. and $55 internationally, you'll have access to a wealth of resources, including our quarterly full-color print magazine, Health Science. Stay updated on the latest health tools, inspiring stories, and exclusive events like the NHA Conference and plant-exclusive cruises. Join us at healthscience.org/membership and make a difference in your life and the world. I'm Dr. Frank Sabatino, your host, and now back to the NHA Health Science Podcast, where more exciting insights await you. Welcome back to the Health Science Podcast. I'm here with my special guest, Dr. Jeffrey Pierce, and we were just talking a little bit about using the power of plant-based nutrition to kind of shape pregnancies and labors and effective births, and I'm assuming in some high-risk situations too, because that's what you are involved in. I know that seems, when I hear that, it seems to be an area that, tell me if I'm wrong, that a lot of physicians kind of shy away from. That high-risk thing kind of scares people off a little bit. You've kind of jumped into that. That seems to be something that you've wrapped your head around pretty well. So Talk a little bit about how open are those women that are going through those pregnancies in the communities where you're doing that work? Because I've seen the power of that and even making easier labors, easier deliveries, and all of that. But how open and how compliant do you find those women that you work with when you lay out this kind of foundation of, and for some of them, I'm sure, a very new way of thinking and living and eating? How does that work?
Yep. I've been very impressed with the results so far. I think that so in our county patient population, we have folks from many different cultures and many different um, financial backgrounds, et cetera. But by and large, these are folks that um, don't often have the same means as a lot of the providers, of course, that are taking care of them. And I think that sometimes there's this idea that only a certain demographic is going to respond to this idea of a plant-based diet or veganism or however we want to phrase it. And it's very quickly, as soon as you start talking to folks of all backgrounds, in my experience so far has been just there is no defining characteristic, that there's just more and more awareness of this. And from I bring up, have you tried any special diets, or what have you thought about eating plants? Oh, I've dabbled with that in the past, or I've really been seeing a lot about that, and I want to try doing more of it. We just had a bit of a short kickstart, sort of a 7-day kickstart at the beginning of the year with faculty and staff at the hospital there, and they're just people who are just bringing all sorts of their own experiences and cultural backgrounds of different flavors, et cetera, where they've been doing just rocking the plant-based lifestyle already. And that was great to be a part of. And I will also say that a lot of the folks there are new immigrants, as far as the patient population are newly immigrated to the United States. And in some ways, that's easier to talk about. Well, think about how your grandparents ate, on the farm, et cetera, where you've come from El Salvador, Mexico. And that's much easier. That's much closer to whole food plant-based eating than what they've been eating since being in the United States for a short amount of time.
Yeah, their indigenous diets are really much more in line with the kinds of things we're trying to share and teach. In that work, do you do community programs, meaning even teaching people how to cook, or doing kinds of things where there's an outreach where they learn how to shop and cook and do preparation? And is that part of how that works for you in that community?
Yes, and I feel like that has been key to success in some of these endeavors. So there's a group that we work with that is community based, that will help get healthy foods delivered to the patient's doorstep. And then we have a group visit where we're talking about the power of food as medicine. And there's a chef there who is saying, okay, with those ingredients that you had delivered on Monday, today we're going to be making a really healthy, fresh salsa to go along with our beans and rice today. And so it's like culturally appropriate foods. It is healthy ingredients. And so it's not just me, in the last 30 seconds of an 8-minute visit saying, you need to eat better, and then moving on to the next topic, right? So it's so much more effective.
So Jeff, let's segue into what drew you then to Love.Life. Let's talk about that service and what that really meant for you and your vision and your philosophy. So let's talk a little bit about, what's your connection to that, and why did you do that, and how does it work for you?
Sure. Well, I feel lucky to be part of this group, and am very thankful for Anthony Masiello and Lori Marbus for taking me on at the beginning several years ago. I felt that there was so much that I could do in a primary care visit, where we're talking about maybe someone's shoulder pain and knee pain and medications and filling out forms, et cetera, et cetera. And oftentimes it was really hard to dedicate the visit to something that is focused on these 6 pillars of eating a healthy diet and getting good movement daily and good sleep and all these things. And so when I heard about a service that was able to really focus on getting to the root cause of illness and then have longer visits, right? Because one of the things that unfortunately we've created for ourselves with the help of insurance companies is the idea of this 15-minute visit, which is just so hard to do anything other than refilling a prescription. So in a place like Love.Life Telehealth, we have 30 to 60 minute long visits where I've had a chance to review somebody's labs beforehand, and then we're just really getting to the crux of things in that 30 to 60 minute visit. And what a great opportunity to do that amongst a group of just stellar doctors that all have, more brilliant things to add to the pot than I do, it feels like. And so that's one of the huge benefits as well.
Yeah, I was very impressed. We've had a number of the people from Love.Life on the podcast, and I was very impressed about how you actually pool information. You actually have almost a rounds where you kind of get together and put all those minds together, kind of like a think tank at times, related to the kinds of service and care that you're giving. I thought that was really, really, really fantastic that you're able to do that. Let me pose this question, because it always comes up for me when you're dealing with these online services like the one you provide. Many of these people, they'll come to you, and I guess that's a little bit of speaking to the choir, because they would come to you knowing about you, and so they're already a little bit in their minds, a little bit ready to be compliant with the kinds of information you're going to share. But many of them still have their own primary care providers, many of whom are just disease managers, many of whom do not have any belief in the kinds of recommendations necessarily that you're making. Is there a conflict with that in terms of the people you work with, and then them going back and getting the information from their primary providers? Is there any conflict in that, and does it affect compliance in any way?
It's a great question. And, I think the fact that most of us in the group are family medicine docs, so we know what it feels like to be a primary care doc. And one of the things that I think is frustrating for many primary care docs is that the patient goes to a specialist or to a consultant, and they get all this information and might get their meds moved around, et cetera. And then there's no back and forth between the consultant and the primary care doc. And then you get, too many cooks in the kitchen, et cetera. And so since I think we all have felt that on the primary care end, I think we're all very aware of that and trying to be open, such as, if your doc ever wants to talk with us, we're available, feel free to share email address, phone numbers, et cetera. And then try not to change medications. I try not to really even be the person prescribing medications, because I love for that to go through the primary doc. So the primary doc is aware of what's going on with something that might be more in his or her wheelhouse. And then I'm just peppering a little bit of extra bits of advice regarding diet and the rest of the pillars, so that we're working together. It's a really important issue, though.
Well, the nice part of that dance is that, and this, is that if they come in and they're on meds for hypertension or high blood sugar or whatever, as they apply the principles that you're sharing, those things naturally change. So the primary doc is put in the position of having to adjust medication, because if he gives the same amount of meds for high blood pressure, it's going to be dangerous. So out of necessity, it almost moves them in the direction of them being less of a manager and more of a healthcare provider themselves. Outcome of this kind of consultation and counseling, it's very cool.
Mm-hmm. Yep. I remember a patient not too long ago who was peeling back her medications for diabetes and for high blood pressure. And she's like, well, I haven't had a chance to talk with my doc about this blood pressure pill. And now when I get up out of bed, I'm a little woozy and my blood pressure is about 100. I'm like, yes, please talk to your doc. But in the meantime, she will understand that you are, stopping this medication until you're able to get through to her office, because we don't want you passing out when you stand up in the morning.
Yeah, right. So, Jeff, let's give people a location where they can find you to learn more about what you're doing, maybe even to get in touch with you, maybe even to make an appointment with you. So what's the website address or the location where you want?
Sure. So the best place to find me for getting an appointment, so that's with me if you live in California, Texas, or Florida, which are the 3 states that I'm licensed in, is at Love.Life /telehealth. And if you live in another state besides that, or perhaps you're interested in a slightly different approach, one of the other great docs in Love.Life Telehealth is going to be able to take care of you. We now are seeing folks in all 50 states and DC. And so you'll be able to find somebody who you click with, and we've got information on our bios there to sort of learn more about us. And then if you want to, I have a private sort of additional website that just has some more resources for books and podcasts and videos and other things like that. And that is jeffpiercemd.com. So that's another place to go look. And then I guess lastly, I do a little bit of work on Instagram, where I do a whole lot of take a lot of photos from the fruit and veg that my family grows in our yard, and I tend to post those on my Instagram account, which is at Dr. Jeff Pierce.
Beautiful. So let's segue into one of your great passions, and that, of course, is the whole area of gardening. And what I liked about what I read, and this is very cool because I love gardening, I love being out in nature, all of it. It was very intriguing how you tied the pillars of lifestyle medicine into the gardening process. So why don't you share a little bit of that? Because I think that kind of vision, that kind of way of looking at it really fleshes it out even to another dimension, how those basic lifestyle factors become very much a part of the gardening process. And in itself, it becomes a major tool for resolving chronic disease. So talk a little bit about that. I found it very intriguing.
Well, thank you for asking me about something that I love to talk about. And
yeah, absolutely.
The rest of the day. But I started gardening about 10 years ago or so, motivated by my wife, who said, well, this is just what I do every year. And so, you should learn to do it too. And so she was my main teacher. And but over the last 10 years, I've dedicated a lot of time learning more about it. And it was at first just kind of something cool to see a seed planted go to something that we harvest that tastes good. And so I didn't do it initially for necessarily to maximize the 6 pillars of lifestyle medicine, for example. But the more I did it, the more I started seeing the benefits. And it wasn't just something that I could talk with my, aunt or mother-in-law about, but that it was something that was really helping my health, my family's health, and in a bigger picture, the community's health and the planet's health, the more that we do this. And I was very much honored for having the opportunity that Dr. Scott Stoll gave me to chat at the last Plantricians conference in Southern California this last September, and that really helped me to focus what are the many great aspects of gardening, and how can we talk about them in a common language. And it turns out that from the 6 main pillars that we all think about in lifestyle medicine to even a few additional points that aren't covered in those 6 pillars, it's not just a hobby, it's not just a pastime, but it ends up being something that's really good for us on multiple levels.
Let's talk about those levels just a little bit so we clarify for people.
Sure. So I think of maybe 9 quick benefits, and I won't spend too long on them because it's kind of a long list. But if we start with the 6 main pillars of lifestyle medicine, clearly, if we're growing an edible garden, we have access to some of the tastiest and healthiest food on the planet. Isn't it amazing that we don't have to have some expensive laboratory or some, complicated machinery to create the world's healthiest food? It just comes from a seed that we can plant in our backyard. And that's just amazing. And I don't have to I don't have to go to the fanciest store in town to pick that produce off the shelf. It's just something that we can grow ourselves. And so the more food that we grow, I just feel like we always have this tasty and healthy food at our fingertips. When I walk out of the door, pretty much any day of the year. And now part of this, I'm lucky to live in a climate like I do in Northern California, but pretty much any day of the year, I'm harvesting 1 to 2 or sometimes even 3 times per day to put stuff on our family's table. So that's maybe the most obvious aspect, is just access to healthy food. Second would be the physical activity. And, if you had asked me back when I was a college age guy, if gardening was going to be the best physical activity for me, I would have joked, because I thought it was about being in the weight room, etc. But gardening has this way to nudge us out of our seats every day that we can get into it, right? Because if we don't go to the gym, we miss out on that workout. But if I don't go out into my garden, I can almost hear the slugs and snails munching on the seedlings right now, right? So you got to go outside and you got to pick them off, and you got to go outside and add a little bit of water during the hot part of the year. You got to go outside and maybe cover up your new little young plants because there's a light frost projected for tomorrow morning.
Mhm.
And those individual actions aren't burning a ton of calories. I mean, they're burning as many calories perhaps that you would burn as when you go for a walk, these lighter activities, but there's something, you're doing it every day, sometimes whether you want to or not, depending how big your garden gets, right? So that the idea of nudges, which is an idea that Dan Buettner talks a lot about in the blue zones, with the fact that these little things that just get you, that keep you active. And so reducing stress, and then also improving sleep are another couple of pillars, because if you get outside and see beautiful things around you, listen to the birds singing, see nature. I mean, there are multiple studies related to what's it like to be out in a forest, and what does it do to your cortisol? What does it do to your blood pressure? What happens to someone's pulse and blood pressure when you listen to bird song? And all these things are happening in the garden. Sleep improves when you're getting out early in the morning. Sunlight hits your eyes and helps to reset your daily clock. And of course, the physical activity also ties into better sleep. Community engagement is huge. And now, granted, we can just garden in our own garden and not talk to anybody, but so much about gardening is tying us with other people. If we're in the front yard, our neighbors are walking by and saying, "Hey, what's that you just planted there the other day?" Or if you're working in a community garden, you're working with other folks in the community. They're giving you advice. You're trading a little sweat equity for it, and you probably go home at the end of the day with a head of cabbage or some other part of their bounty. Another aspect that I think about also is how it helps to reduce our exposure to different toxins in our environment. And so you can get organic grapes that unfortunately have by spray from the neighboring field for the non-organic grapes. In my little patch, in my little urban garden here, by spray is very unlikely, and I can be in charge of pretty much anything that goes into the garden and be picky about it. I could even say, well, I don't want any animal manure or any feather, bone, and blood products that go into organic produce all the time, and try to grow what they call veganically if I want to. And so there are all these different levels of control that we've got when it comes to what comes into our diet.
Jeff, I know when you talk about it, one of the tips you tell people or you've shared with people is to just start small. What kind of patch do you actually have in your urban garden? I mean, what kind of a space have you devoted to that? So people have an idea like, well, I don't need like acreage to do this. I just need, so give them a little idea of what you have and what starting small actually could mean to someone out here.
Sure. So when I chat with folks about starting small, the idea of just doing a tomato plant or some herbs on the windowsill or some sprouts, there are all sorts of ways to start really manageably, especially if you feel like, wow, my day is totally full. I don't even have enough time to, get out of my work clothes before I fall into bed, so probably starting 12 raised beds or something like that's not going to be a great idea, because you'll get frustrated and say, I knew I shouldn't have done this. This was a crazy idea. So just start super small. We have an average size lot, maybe a little bit larger than an average size lot in a city. I think the whole lot, including the house, is less than a fifth of an acre or something like that. And we just have tried to convert all of the space into growing areas. So for growing vegetables, we've built raised beds with sort of wooden sides and all that kind of stuff. But for the soil that is not quite as nice, you can still put a small fruit tree or a blueberry bush or a blackberry bush, which blackberries go pretty wild in our area. So you certainly don't have to have the most prime spot for them. Now we have created this jungle to where it's a little bit hard to leave on vacation, because I feel like there's always something in the works. One, because I don't want to miss what's in season. And then two, I feel like they're all my babies and I don't like leaving them for too long.
And you put in quite a few fruit trees now too, right? I mean, that's been an expansion of what you've done.
Yes, when we moved here, there was one small lemon tree that I didn't even know what it was. I was going to cut it down, but my wife said, "Well, let's wait and see what it is." And it ended up being like this amazing Meyer lemon tree. And there were like 4 small raised beds that were full of weeds and grasses, right? And now we probably this is considering that they're very small trees, and some of them are just in pots, etc. But we probably have, I don't know, somewhere between 60 to 80 fruit trees and bushes if you put them together. And that's just so fun, because we can go out starting in April or May maybe and just be picking things year round. And that's been particularly fun with my daughter, who she's a bit of a super taster. So getting her to enjoy the kale and the collards that I put on her plate is sometimes a struggle, but that's not a struggle to get her to eat the strawberries and the blueberries and the blackberries.
Right. Well, we love, we're fruit eaters by nature. That we like that sweet stuff. But I always found, I raised a bunch of kids too. And one of my philosophies, and I always tell people, is with children, if you get them to make it or grow it, they'll eat it. And that's one of the ways you turn them on to a healthy lifestyle in terms of, and it also helps them recognize the importance of the environment and things that you've actually put on your website too. So I'm in complete agreement with that. And it's a good way to get younger, kids and the younger generation interested in embracing this very healthy lifestyle that's going to be so protective, not only of their own health, but of the environment too that we live in, which is critical at this point. But making it so all my guys were making food in the kitchen from very early and growing sprouts, and we didn't have any land, so we did indoor sprouting and a lot of that kind of thing. And so it's beautiful. And I think, like you make the point, it doesn't take a lot of space to create a very productive little patch that can be providing some very lovely things for your family. How much do you have to actually go beyond what you grow to actually shop and bring into the home?
Yeah, so I think if we were just saying, well, I'm going to just eat what comes from our land, we would change things around a little bit and plant more high calorie crops like potatoes and sweet potatoes and winter squash, for example.
Right.
The way we've done it is that we plant things that we really enjoy eating, and a focus on the fruits. And then, because there's certain foods that my daughter prefers or that we prefer that we don't grow, we're still going to the grocery store and spending, unfortunately, plenty of money at the grocery store to get things like that. But I don't buy peaches and I don't buy plums and I don't buy oranges and things like that, because the trees have gotten to a point to where we can have a pretty large harvest and a consecutive harvest, which is one of the benefits of having a bunch of different varieties. Because
that's fantastic.
Early, middle, and late. Yeah,
that's really fantastic. So, in terms of your time, I mean, you're a busy person. You're online. You've got private patients. So the gardening is one of the main things of your physical activity that you come home to and look forward to doing, basically, in your life.
Oh, for sure. It's I'm a runner, so I still try to go out multiple times a week for a jog because it's particularly getting out into a really forested area still gives me a level of peace that I don't get when I'm running around my garden thinking of all the things that I have to do there. But it's just become just such a daily part of the routine that it's just integral to how I sort of define, okay, what am I doing today? I gotta see these patients, gotta go weed the strawberry bed, gotta put food on the table. Like it's just part of my daily.
Do you have any, let's say, visions or plans for the future that you would like to accomplish in terms of your professional life or any aspect of your life in terms of anything related to patient care, relating to writing, to relating to whatever? Is there anything on the horizon you would like to get done for you?
Yeah. Well, I'm really starting to explore and work that line between health and gardening, because I think we've got a lot of gardening experts and we have a whole lot of health experts. And then there are a lot of people who are doing gardening and don't realize the health aspects of it. So currently I'm taking a 5-month course through the University of California extension in the Master Gardener program. I'm taking another course on veganic growing and starting to work with how can, in our community and beyond, how can we get more awareness of this? Is it going to be more articles with different publications to sort of share this information? Because I think when we start to, the more we see the power of making our own compost, like you had been speaking with Joseph Witten in the past with his makesoil.org and all these other folks who are really trying to bring home the fact that we have so much power in our hands for our health, our community, and for the planet when it comes to where our food comes from and what we do with our food scraps, et cetera, that I just want to be part of that message, part of that voice, getting it out.
If you remember Woodstock, we are stardust, we are golden, we are billion-year-old carbon. We have to get ourselves back to the garden. Mm-hmm. And I love that line in that song, and it's so true. And what you're doing is really the epitome of, I think, a way that we have to go. I mean, I think we have to go back to really nurturing soil, nurturing the way we produce food, and breaking the cycles of abuse that are so tied into food production, as you pointed out, even on your site. So, Jeff, as we wind this down, are there any final words you'd like to share with the audience out here?
Well, just a reminder, and I think most people or everyone maybe even listening to your podcast on a regular basis already has this to heart, but that we have so much control over our health, that it's that we're not doomed to what our genes have laid out for us. And so from what we eat and how we move and these daily little choices just allow us to get to the root cause of some of these conditions that might have been nagging and plaguing our health. And the more you listen to Dr. Sabatino and all the guests he has on his podcast, the more you realize that we have the control in our hands by and large, as far as when it comes to chronic illnesses.
Well, I can't thank my special guest, Dr. Jeffrey Pierce, enough for being with us today, sharing his insight, his experience, and also the beautiful message about really the importance of getting out in the garden, getting out in nature. I urge you to follow Dr. Pierce. You see his site strolling across our screen. It's in the show notes. And I also want to thank the people that have joined us today, because without you, we can't do what we do. I want to thank you for being part of this active, healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino. I thank you for joining us today, and I look forward to being with you on the next episode of the Health Science Podcast.